Thank you, Tracy. So can everybody hear me okay? So this is a really great opportunity to present the findings of a study that has been ongoing for about 3 years now. It has been a project that has been full of some challenges, which we'll talk about at the end. But at this point, we are quite excited to be able to share the findings. Today, we're going to talk about some of the high-level findings, so overall findings from the study. But over the next few months, we'll be doing additional presentations looking at some of the sub-analysis and looking at some of these issues in a little bit more depth. So thank you for attending today. And at any point during the presentation, please don't hesitate to stop me if you have any questions. So Tracy has already done the land acknowledgement, so I won't repeat it, except to acknowledge the lands that we are currently living, working, and playing, and our gratitude therein. Additional acknowledgements. So this research was supported by a grant from the Research and Workplace Innovation Program of the Workers' Compensation Board of Manitoba. And without their support, the research would not have been possible. And really a sincere thanks to the participants for sharing their stories, their insights, and their time. The drivers gave us incredible perspectives into their experiences in their work worlds. So this research has had a really strong research team. Myself as the principal investigator. We had Neil Cook. Neil Cook is currently the president of MIT, but he is also at the time was working as an educator for the Manitoba Trucking Association and has strong links to the trucking industry. Carla is a registered dietitian and also teaches nutrition at the University of Manitoba and at Red River College. And Joel here at Brandon University has expertise in physical activity and has brought very important perspectives to this research. So we had an interdisciplinary research team. We have also been privileged over the 3 years to have research assistants from a variety of different faculties and with incredible strengths. So currently our research assistants are Danica Fitzsimmons, who is doing a master's in public health at the University of Toronto, Carolyn Mullins, who works here as in teaching nutrition and other courses within the nursing department. Jasmine is a nursing student here in the Bachelor of Nursing program. And in the past, Jessie, who was a psychology student here at Brandon, is now a law student. Tara was a student in a dietitian program at the University of Manitoba. And Riley was in the psychiatric nursing program here at Brandon, but now is doing a master's degree at the University of Alberta. So we have had the opportunity to have the input from very many people, which has brought a really strong interdisciplinary focus to the research. So what have we done? So a little bit of background. Long-haul truck drivers have been identified certainly as a high-risk population for things like obesity, cardiovascular disease, diabetes, sleep apnea, musculoskeletal injuries, depression, and stress, and certainly more than that. Sedentary work, the number of hours of sleep they get, limited opportunities for physical activity, and unhealthy eating patterns have all been found to contribute to the onset of chronic conditions among truck drivers. However, workplace health promotion programs that have focused largely on simply changing individual worker behaviors and have had less emphasis on the broader contextual factors within the environment that contribute to poor health practices have had really, those programs have had very limited success. So what we wanted to do was we wanted to adopt a broader lens. We wanted to take a social ecological approach, really to look at the complex interdependencies between those individual health practices and aspects within the work environment. And we wanted the social ecological perspective targets both workers' behaviors as well as those environmental determinants of health. And it has been seen to be a more effective way to approach health promotion programming. So the framework, the social ecological framework described by Lingard and Turner, is what we use to guide this research. So what were our overall research objectives? We wanted to describe how the mobile work environment, and by mobile work environment, we were looking at the highways and infrastructure, truck stops and rest stops and pullouts and areas along the route. And we were also looking at the actual environment of the truck itself. We decided to define the mobile work environment as the area between Manitoba and Calgary, and Winnipeg and Calgary, and Winnipeg and Edmonton. So two major truck routes for drivers in the prairies. So we wanted to describe how the mobile work environment supported or hindered healthy lifestyle practices amongst long-haul truck drivers. We wanted to be able to identify and describe the current health practices of long-haul truck drivers while they were at work. And we wanted to identify and describe the long-haul truck drivers' perceptions of the barriers and facilitators to adopting and maintaining healthy lifestyle practices while they were at work. So those were our primary objectives. To do this, we used a mixed methods design, and we collected data from a number of different sources. So the first source of data was an environmental scan. And an environmental scan was, I'll tell you a little bit more about it, but it looked at the Trans-Canada between Winnipeg and Calgary, and also the Yellowhead route between Portage la Prairie and Edmonton. Then we did 13 qualitative interviews, and we maintained activity logs for 9 drivers and diet logs for 8. And the reason those numbers are different really had to do with some challenges we had with recruitment. So our initial intent was to recruit 24 drivers with a hope that we would actually successfully have data on 20. But despite multiple changes to recruitment strategies, we continued to struggle to get drivers to participate. So in the end, we ended up with 13 drivers. Of those, 8 of them participated in 2 interviews, and 8, the initial interview was conducted at the beginning of the research. Then we asked those drivers to maintain activity logs and diet logs. And then we interviewed them again at the end. And then we changed our protocol in the last 6 months to try and get additional drivers to participate. And those drivers we asked just to participate in a single interview. So issues with recruitment were certainly one of our biggest challenges. Once we collected the data, we analyzed the data using the framework form of analysis. And in mixed methods research, how you analyze your data is often, there are various ways. What we chose to do was to analyze our each data set individually and then integrate the data and findings at the end. So we analyzed the environmental scan, then the qualitative interview transcripts, and diet and activity logs. And we had 4 members of the research team that were involved in the data analysis, 2 of the investigators and co-investigators, and 2 research assistants. And then those analysis, the findings then were shared with other members of the research team for validity and for further conversation. So let's just look quickly at what we did for the environmental scan. So for the environmental scan, we had 2 research assistants, and that was actually Riley and Tara. And they conducted the scan by driving from Winnipeg to Calgary and back over a 4-day period. And what they did was they collected data from a sample of 20 truck stops, and those truck stops had to be accessible to LCVs or long combination vehicles. So those are the double trailers, because we recognize that pulling a double probably has additional limitations to having a single truck. So we looked at 20 truck stops accessible to LCVs along the corridor between Winnipeg and Calgary. And then we sampled according to geographic region and direction of travel, so whether it was going east or west, and they had to be accessible in the direction that they were traveling. So what we did was we divided the highway into highway segments of approximately 100 kilometers. And then if there were multiple truck stops available within that 100-kilometer region, we conducted stratified random sampling. So our total, we ended up with the 20, we ended up with 6 in Manitoba, 7 in Saskatchewan, and 7 in Alberta. And those dots just show you how it worked along the way. So we had fairly good representation from across the truck route. So in terms of what we used to collect the data on the environmental scan, we adapted with permission a version of a truck stop checklist observational tool that had been developed by the National Institute for Occupational Safety and Health. And we ended up with a final checklist that looked at both indoor amenities, and we divided those into 2 categories. So dietary, what kinds of food was available for purchase, either as a single food item or as a snack item or in a restaurant that was attached to the truck stop. And then a non-dietary tool, which looked at things like showers, access to gyms, or areas that truck drivers would be able to engage in physical activity. And then outdoor amenities looked again at things like lighting, the availability of areas to walk, perhaps access to walking paths. The tool that we developed, we made quite a lot of modifications in reference to the dietary component, fewer in modifications in relation to the non-dietary. But the tool worked very well. We also did, in addition to the actual truck stop checklist, they conducted an in-transit tool, which was basically a checklist which was filled out as they were driving along. And it looked at things like anticipatory signage. So if there was a turnout, was there a lot of signage for trucks to slow down, pull over? What was it like in terms of entrance and exit lanes? Were they having to make a hard turn, or was it designed for trucks? Looked at things like safe temporary parking or safe overnight parking. And we did that, the in-transit tool did both sections of the Trans-Canada and the Yellowhead. So the other data that we collected diet log data, and this just gives you a simple example of a potential diet of how they could have filled it out. So we were looking at basically the date, the time of day, or their day on the route rather. Was it 1 day of travel, day 2, day 3 of being on the road? How many days were they away? The timing, the actual time, and then details of what the food was, the quantity. And then we asked them as much as possible to take photographs of the food. And the photographs have become a really important source of data for us. The drivers were provided with an iPad where they could they could fill out their diet logs, but also they could take photographs of the food that they were eating. And those are just a few examples of the food that they are bringing along with them and eating. And you can see some of their meals are fairly elaborate. We also asked them to keep a physical activity log, and Joel, who's here today, was very instrumental in putting this tool together, where we asked them again, date and day, the time, how long was the period of activity, and then the type of exercise, whether it was stretching, resistance, or cardio, the intensity, light, moderate, or high, and the purpose, was it work or leisure? And then we asked them to provide a detailed description, and we defined these terms for them. But you see a lot of their physical activity while at work is not surprisingly work-related, doing vehicle checks, pre-trip, post-trip walks around the vehicle, and occasionally adding additional steps when they're walking to coffee shops or getting refreshments or to washrooms. And then the third major source of data that we have was the telephone interviews. They were conducted, as I said, with 13 drivers. So 8 participated in 2 interviews. The second, one person refused the second interview. The purpose of the second interview was really just to review the diet and activity logs to try and get a better sense as to what they were eating or how they were moving. And then additional 5 participants participated in a single in-depth interview. And we conducted interviews in both English and Punjabi. Jasmine is fluent in both languages, so she was able to interview participants in their preferred language, and was able to do the transcription for us. So a little bit about the participants. We will see that if self-reported BMI, so this was their own giving us height and weight, we see that 7 of the drivers were categorized in the overweight, 3 in the obese category, and 3 in the normal category for weight. Age, we had 5 participants who were between 30 and 40, and then we had 5 participants between 51 and 60. And then just a couple of participants between 41 and 50, and 2 above the age of 61. All our participants self-identified as male. We had 4 that had been driving for less than 10 years, but none had been driving for less than 5 years. So we had, for the most part, all our participants had a good level of experience with long-haul driving. And we had several drivers that had been driving for, 6 above 31 years, so a lot of experience. What became important, certainly when we're looking at the environment and health promotion, was whether they were driving as a team driver, where they each take a shift, but the truck is almost in continuous motion, except when they're doing vehicle checks. So one drives and one rests or sleeps, and then they switch, versus solo drivers who were driving on their own and then taking a break and then resuming driving. And certainly we see differences in the health challenges as well as how they support themselves health-wise, depending on the type of driving that they are doing. So today we're just going to talk about physical health. We also asked the question about perception of mental health, but one of our research assistants, Danica, is doing a presentation at the Mental Health on the Prairies conference that will focus specifically on that. So today we're just going to focus on perception of physical health. So drivers, you see here how they self-reported. So many of the drivers put themselves in a 7, 7.5, or 8 category, which was great. We had one driver, we had 3 drivers that rated their health as a 5 or fairly poorly. But when we ask them to describe why, or tell us why they used or applied the score that they scored, the responses really fell into 3 main categories. So either the presence or absence of health issues. So something, well, I don't have any health issues other than I have a bad back. So they felt healthy because they don't have a diagnosis. For others, and not surprisingly, because we had given them physical activity and diet logs, so they knew the focus of this research was looking at physical activity and diet. So they defined health accordingly. And quite a number of them really defined their health score based on their own perception of whether they were getting enough physical activity or if they were eating a healthy diet. So I don't eat a lot of crap. I'm careful about what I eat and how much I eat. And when I'm at home, my wife and I, we go for walks. And I don't sit in front of the television all the time. And others defined it based on their ability or not to be able to carry on at work and to do basically what they wanted to do. So for me, it's physical mobility and just generally staying on top of the basic health for aches and pains so that I can still do physical labor required, even though I'm not as active as I used to be. So their ability to still do their job. So this is really just an example of the final coding framework that we ended up with when we're looking all of the different sources of data and putting it all together. And this is the broad coding framework. I'm going to talk about the individual, family, occupational, and economic influences today, but we did then do a sub-analysis for each of these in relation to physical activity, sleep, mental illness, mental health, and diet. So, but today we're going to talk broad, and I'll bring examples in from the different areas. So if we look at what were the individual and family level influences that the drivers identified. Now, remember this, there could be many more. These are the ones that our 13 participants identified. And these were the main themes that emerged from our data. So motivation, some of them certainly were motivated by the presence of a diagnosis, type 2 diabetes, for example. Others were or lacked motivation because they had perhaps musculoskeletal issues. One required surgery for hip and knee, and so found physical activity beyond what he had to do for work was challenging. Motivation, they also talked about in terms of fatigue and energy levels. So if they were tired, they didn't feel motivated to necessarily engage in any level of physical activity, for example. For others, motivation was very much physical activity, healthy eating was a high priority to them. They brought exercise equipment in the truck with them. They perhaps used smartwatches to count steps. One of our participants went for a run whenever he had an opportunity or a longer break. But for others, it was just not a priority. So they knew that they should be physically active. They knew that they should eat a healthy diet, but they were really not very motivated. And so even if gym equipment was available to them, or they felt they had a little bit of extra time, maybe at the end of a route, physical activity wasn't something that they were interested in participating. So individual motivation was certainly a factor. One of the main areas that emerged from our data is looking at health literacy. So in relation to exercise, for example, it was viewing physical activity as simply exercise. So they didn't look at engaging in activity for leisure or even engaging in activity for work-related purposes as beneficial. They were thinking that in order to be physically active, they simply had to go to the gym, they had to work out, and defining that the movement in relation to exercise and exercise alone. In relation to food and nutrition literacy, this has become a fairly significant component of the diet analysis, looking at really what was their perceived healthfulness of foods. So do they know whether foods are in fact healthy or unhealthy? And one quote that just stands out in relation to nutrition knowledge was one of the drivers said, "I don't know what classifies as healthy is really like. You know, the healthiest thing I see on a menu is porridge, but I don't even know if porridge is healthy." So unsure of what healthy food looks like. They would all identify certainly as salad, but in terms of other components of nutrition and health, they were often questioning their own ability. One of the things that was a very significant finding was that the vast majority of the drivers we interviewed bring all, if not most, if not all of their food from home. And so the health literacy or nutrition literacy of the person preparing the food is an important component of health promotion. So the drivers themselves would often not be able to tell you what ingredients went into the food, but they attribute it to being healthy because it was prepared at home. And some of that food was incredibly healthy. And some of that food may not have been as healthy if it was prepared in using a lot of fat or oil. Cultural practices. So cultural practices primarily became a factor in relation to food and nutrition and really around food preferences. So some of the drivers that we interviewed that came from India had felt a real absence of Indian food restaurants that they would be able to frequent along the way. And so as a result, they brought most of their food from home. And likewise, in relation to being vegetarian, drivers often found it difficult to find a lot of vegetarian options. So that impacted their decision about whether or not they were going to purchase or bring food. And family roles and responsibilities. So certainly family support, especially in relation to bringing food from home, was considered to be a strong factor in their health. And I'm just going to read you what one driver brings on an average trip, because I think this tells you exactly how much food they're fitting into the fridges in their trucks. His wife bakes frozen meals, and he brings them with him in the truck, and then he heats them up. So right now, this is what he told the research assistant. I have zucchini supreme and pork, Korean chicken with asparagus and potatoes, cabbage rolls, and then we've got Angus burger, vegetables and potatoes, pork mash and stir fry, spaghetti and salmon, cinnamon chicken, something that my wife has invented. I hope it's good. Turkey casserole, stir fry with black bean sauce, cabbage, onion, rice, cinnamon chicken again, and Greek fried rice, and a Dutch oven beef brisket. So these individuals are getting quite a lot of support at times from their partners when they're bringing all of this food. But likewise, many of them had a lot of family responsibilities and commitments. So as several of our drivers, and especially younger drivers, they would talk about they would drive for 3 or 4 days, 4 or 5 days at a time. Then they come home. They're only home for 48 hours or a short period of time. And in that time, they have to, if they've got elderly parents, if they've got children, they've got work around the house that needs to be done. And so that impacts on their ability to engage in physical activity, perhaps on their days off. So they're struggling to find time while they're at work, but also they don't have a great deal of time in their home time in order to engage in those activities. So then we go up to the next level of influences, and these would be your occupational level influences. So here we're looking at the nature of work. So truck driving is a sedentary job. Whether or not they work as team or solo drivers. So for instance, team drivers would identify that one of the greatest barriers or things hindering their sleep was the road surface. So when they were hitting a lot of potholes, especially when they get into some of our Manitoba highways, that was waking them up and impacting their ability to sleep. Solo drivers, on the other hand, when it came to sleep, one of the things that impacted them was inadequate feeling of safe parking places. So when they're on the side of the road, if they're not in a good pull off, if they're just on the edge of the road because they couldn't find a place to park, they're very worried about their safety. They're worried about someone coming and careering into them. And so that's interrupting their sleep. So different things depending on what type of work they're doing. Long hours and irregular schedules. So sometimes they make plans. One driver was making plans for a fishing trip and then got called in to do a route to Calgary. And that required him to start driving on a Sunday. And so therefore he wasn't able then to take his fishing trip. So they don't always know their schedule well in advance, and that was impacting sometimes on their ability to plan things. And then the physical demands of their work really varied. So for some, they had a lot. So one participant talked about, well, for me, I do flat deck. So you're strapping down loads or chaining loads down and you're fighting with your tarps. From my side of it, because we've got to check the loads every 2 to 3 hours, you're getting out of the seat and you're manually doing a lot. Whereas another driver who drives a tanker was saying, I don't have anything to unload by hand, and all I do is just a 2-inch hose that I use to hook to a tank and then climbing up and down off my trailer. So there's not a lot of physical activity. So the physical demands of their job varied. The mobile work environment, here if we look at 3 specific things, the truck amenities. So the drivers, some of their trucks are incredibly well equipped. So they've got fridges, they've got microwaves. They did talk about the quality of their mattresses, about climate control within their trucks, making a big difference in relation to their sleep. So the amenities that are available to them impact on their health behaviors. Trucking company amenities, we had some trucking companies that would have gyms available at their depots, and we have others that have overnight parking areas available, and so people have safe places to park, whereas other trucking companies don't have those same level of supports available. And then the private sector amenities. So we look just quickly at the environmental scan. What we found was that sorry, I'm just looking for it in my notes. I don't have it, that's all right. The private sector amenities, you certainly could purchase healthy foods at truck stops, but the options and the variety was very limited. But none of the truck stops that we reviewed had any ability to had any exercise equipment, either in exercise rooms, or they didn't have any exercise areas in the outdoor areas either. So the trucking, certainly the private sector amenities varied, but many of them are not certainly in place at this point to support physical activity. And then we look at the final occupational level influence of industry culture. And here we're looking at really the industry of, or the culture of the trucking industry. And the one that stood out the most was time pressures. So drivers don't feel that they have time to stop beyond what they're allowed in terms of their safety checks and within their day. There's certainly pressure demands, delivery demands, time demands, and that was coming from the drivers. They felt it was also coming from the clients, and it was also coming from the trucking companies at times. So that whole culture of time and pressure. And the last level is looking at economic level influences, and these probably had some of the greatest influence for drivers in terms of their own perceptions of things that influence their health. So government policies and regulations, one of the ones that they talked about at length was the introduction of an electronic log. And although many of the drivers see the benefit of the electronic log, because it stops you driving more than you are allowed by law. Its inflexibility has created a number of stressors for drivers. And so when you are allowed to drive for a period of time, when you get to that level of time, the log doesn't allow you to continue. So if you're driving along and you're at the end of your allotted hours and there's no safe place to park, they feel they need to pull over and park at the side of the road. And this electronic logs, there's a whole lot of conversation that can happen around this. Some of it is not fully understanding the logs, and some of it is this time pressure where they push themselves right to the limit. So they're not thinking that they could stop half an hour early when they're at a safe place. They feel compelled to go right to the very limit. So some of it is certainly occupational, but some of them is in looking at the policies. Then trucking company policies and practices. So we had a huge variety here. We had trucking companies that pushed drivers to drive and others that supported them when they couldn't. One of the quotes that I think stands out is, first, it's difficult to find time, especially to exercise. And if you're a single driver, you have 8 hours allotted to sleep. And once that time is up, you need to start your log and be driving. So if after those 8 hours you want to take time out from driving, then the dispatcher at the company says that you've caused a delay with the load delivery. They inquire about why are you delaying your start and your driving schedule. So they didn't feel that they could be supported in taking a longer break than they were allowed based on the regulations. Whereas other trucking companies had the gyms at their yards. And this fellow said that for my company, they don't ask us to start our drive back at a particular time. So we have the option of driving back a little bit later. And in the meantime, we could go to the gym. It's open to everybody. You don't need a pass, and that's made available to everyone. So trucking companies themselves, some were very supportive and some not so. The availability of private sector services, and I've talked a little bit about that as well, but what is available in terms of infrastructure to support healthy eating, healthy sleep, and physical activity along the way. The affordability of healthy living came up as a theme, and that in particular was in relation to the cost, primarily of healthy food. And highways and infrastructure. So I could do an entire presentation on the number of times that they talked about highways and infrastructure, but these largely came up with things like no safe places to pull over. So they have to do safety checks every couple of hours, but there's no safe place on the highway to do it. And so while many of them said they would like to take a little bit more of a walk, they didn't feel that they had the ability to do that because it wasn't safe to be getting out of your truck. And anybody who's driven the Trans-Canada recently, you'll see drivers at the side of the road, and when they're jumping out, they're jumping over that white line and into the oncoming traffic lane. So it really isn't ideal. They talked about potholes and poor highway maintenance as impacting sleep. They talked about limited rest stops, and those rest stops didn't have any walking areas, didn't have access to good picnic benches, or weren't able to accommodate double LCVs or trucks. So many of them were just able to accommodate drivers of cars. So highways and infrastructure were significant in relation to their perceptions and their healthy practices. So you can't really see from these photographs, but a few little examples. So here's a truck just at the side of the road because there's no turnoff. So they take a little side road or secondary road that comes onto the highway. There's a little bit of an opening there, and that's where they pull over. But if you see from that picture on the right there, the driver would just be getting out into oncoming traffic. Or you see certainly a little bit of track out here, so a widening of the shoulder, but you can see that semis have had to come to quite a quick stop to get there, as opposed to this one down at the bottom, which is a much safer pullout where they actually are completely going off the highway. Lots of room for semis, and so they can get out and the conditions would be much safer. Rest stops, that's just showing you the no trucks allowed. This is a really lovely rest stop at the Manitoba-Saskatchewan border and certainly can accommodate semis, sorry. But the drivers talk about the pathway into it having a lot of potholes and difficult maintenance, especially in spring, so making it a little bit hard. Parking, they talked about parking all of the time. So you've got your restaurants like Tim Hortons, or in this case, McDonald's. These are both recent pictures, but that's the McDonald's in Brandon. So no semis are allowed. But if you go right outside the McDonald's, there's the McDonald's. There's also no parking allowed on the secondary road here. So they find it very difficult to find places to park that are legal and that they could access other restaurants other than truck stop places. Now, most of them, so this is the no heavy trucks allowed. There's a no parking sign along here. So some of them tell us about the fact that they just are being forced into parking illegally, which of course contributes to stress, and hope they don't get a ticket. But there just isn't adequate places for them to park. So infrastructure was one of the most significant things. So just quickly, some of the implications for this. So definitely this research supports that a multi-level approach to health promotion is required for this population. So you can certainly put gyms in place, but without individual motivation, those gyms will be empty. You can encourage physical activity, and a driver can be very motivated to engage in physical activity, but when the infrastructure, when there are no safe places for them to go for a run, to go for a walk, there's no safe access to walking paths, that activity won't happen as well. And so it requires looking at the individual level, occupational level, and from our findings, certainly we found that the economic level is probably some of the most significant in terms of infrastructure that supports it. We're also at a really key time right now in terms of infrastructure because as the trucking industry moves away from its reliance on fossil fuels, there'll be a need for new infrastructure development, and it gives us a perfect opportunity to do the next, which is to build health into all of our policies. So the Health in All Policies is a global initiative that's looking at how do we consider in everything that we do the health to the population. And so when we're building roads, we should be considering how we can support those that use those roads as their workplace. And for us as a team, it's had certainly some significance in terms of our knowledge translation activities. So we've tried to target those activities to all three levels. So we're developing educational modules and podcasts for drivers. We're looking at presentations with the Manitoba Trucking Association and all of their members. And then we are hosting a forum for government officials and trucking company owners and senior executives. So we're hoping to target all three of those stakeholders in our findings. So limitations very quickly, recruitment challenges. We had a very small sample size. We only had men in our group. We had to revise our research protocol because the participant burden that came along with those diet and exercise logs was limiting participation. So we ended up with certainly a smaller sample size than we would have hoped. Self-reported data. So we are only getting the perspectives of truck drivers, and we're only getting their individual perspectives. And so I think we just need to be aware of that when we're interpreting findings. So we don't have the perspectives of those trucking company owners or executives or government in this particular data. So that is the end of my presentation. Does anyone have any questions? Sorry, that was way more information than I thought it was, but so I hope I haven't overwhelmed you or put you to sleep.